Hematocrit, or HCT in short, refers to the percentage of red blood cells in the total blood volume. Usually, the hematocrit levels are identified as part of a complete blood count, but they can also be tested alone. However, a complete blood count is the most common blood test that measures hematocrit while also measuring the red blood cell count, white blood cell count, hemoglobin levels, and platelets. The reference range of hematocrit in an adult male is 40% to 54%, and adult female have an HCT that ranges from 36% to 48%. Why is hematocrit important? Hematocrit is a very useful laboratory finding, as having too few or too many red blood cells may be a clinical indication of various medical conditions, like anemia or polycythemia respectively. It can also be used to monitor individuals post-operatively in order to prevent or screen for complications, like internal bleeding. So what causes low hematocrit levels? Low hematocrit levels, also known as anemia, may be the result of decreased production of RBCs, increased loss of blood, increased destruction of RBCs, or a combination of these. The most common cause of low hematocrit levels is chronic, like ulcers, colon cancer, or it can be acute, such as trauma and internal bleeding, which leads to significant blood loss. Notably, females of reproductive age may have low hematocrit due to menstruation. However, hematocrit may also decrease due to peripheral destruction of RBCs, as seen in conditions like sickle cell anemia, where RBCs have a shorter lifespan, and splenomegaly, which is the enlargement of the spleen, where a great number of healthy RBCs are destroyed in the spleen. Another cause of low hematocrit is decreased production of RBCs, as seen in chronic inflammatory diseases, or bone marrow suppression caused by radiation therapy, malignancies, or medications like chemotherapy. Lastly, malnourishment such as iron, vitamin B12, and folate deficiency, as well as overhydration, may also lead to decreased hematocrit levels. Now, what causes high hematocrit levels? High hematocrit levels may be the result of hemoconcentration or overproduction of RBCs. Dehydration due to fluid loss from repetitive vomiting, overheating, or limited access to fluids may cause hemoconcentration. Additionally, low oxygen availability triggers the production of new blood cells in order to transport oxygen throughout the body. And it can be caused by smoking, high altitudes, congenital heart diseases, or certain pulmonary disorders such as pulmonary fibrosis or COPD. In addition, polycythemia vera, which is characterized by the overproduction of RBCs, can also cause high hematocrit levels. Similarly, increased erythropoietin production and various conditions of endocrine system, like Cushing's syndrome, may also result in high hematocrit levels.